Hi, this is Adobe Okoye, and welcome to my platform, Nursing and Therapy. As the name implies, we talk about all aspects of life and therapy. Please relax, listen, and remember to share with your friends.
Hi everyone, welcome back again to Nursing and Therapy. My name is Adobe Okoye, and today the message I have here is for both men and women, especially the men. Okay, I'll give reasons why I said especially the men. So before we start, I just want to mention something. What women go through in life, like it's a lot. Sometimes women don't understand why, and no one understands why actually. But let's just leave it to the hormones. So let's start from growing up as a little girl, having some physical development, such as growing of breasts, and then to seeing your periods, which most of the times it comes with pain, but it depends on the individual differences. Some women don't get the pain, while some get that pain. The topic is endometriosis. So that is what I want to discuss today. And the reason for this discussion is simple. It's just because it affects women, it affects fertility, it affects the mental general well-being, and then it can affect your family, it can affect your love life, especially if you do not have a supportive partner. So that is the reason I said I'm going to discuss why I'm also talking to not just women, but especially the men. In situations like this, where you have your partner undergoing this kind of diagnosis or, condition, you just have to be very supportive. And I'm bringing this to you so that you'll be aware that there are things like this. There are things you cannot control as a human being. You just have to, have a way to manage it. But the best thing you can do for yourself and the best thing you can do for your partner is being understanding and treat them well, treat them right, no matter what happens and no matter what they're going through. So to start up, I would say that endometriosis is a condition where the tissues that are similar to the lining of the womb grows in other places, such as the ovaries and the fallopian tubes. It's just like having something where it's not supposed to be. It can affect a lot of things. Talk more of having this kind of stuff in your body. All right. So there are some possible causes of this endometriosis. It also wanted to know that research or science can't really tell the exact cause or the reasons why this happens, but there's some possible causes of it. The first one being genetics. If you have your mom, your grandmom, or someone from your family have this endometriosis, it's very much possible that you could have it. Then, if you have got problems with your immune system, the immune system is the body's natural defense against illness and infection. You can have the problem as well. Then, if you undergo surgeries like the cesarean section surgeries, which most of the women undergo, you can have instances where the endometrial cells, may attach to scar tissues. Let me just, explain it in a way that you understand. If you have any surgery, there may be an attachment to that part where you had the surgery, and then it could cause endometriosis. Everything just depends on the womb reproductive system. All right. So let's look at the risk factors. Research has also made it known that there are some risk factors to this endometriosis. The first one is never giving birth or never having a child, if never having or seeing your period very early, at a very early age, already menstruating, having short menstrual cycles, that's less than 27 days. Some people get their menstrual cycle to be like they're very short, like 24, 25. Some even go 23. Yes. Another one is having heavy menstrual periods that last longer than 7 days. Some people get their periods for like 2 weeks. If you're seeing your periods for 2 weeks, 7 days and more, and it's very heavy, just know that most of the times it's not normal. Something could possibly be wrong somewhere. And then another risk factor is when you have a high level of estrogen in your body. That's the woman hormone. Let me put it that way. All right. Let's talk about some common symptoms of endometriosis. The most common symptom or the most severe one people always talk about pain in the lower abdomen. This really happens or usually happens whenever they are menstruating. They get severe pain, like it's really very painful, to that pelvic area. And this pain becomes unbearable for them that you see most of them, they can't do anything they normally do. Like it stops you from carrying out your normal activities. Most of them get pain during or after sex, pain when they are weaning or when they are opening their bowels or having a poo during that period, and then they feel sick, they're constipating, some of them have diarrhea, and then to make it worse, they start bleeding. It's not just the normal period now, they're more like bleeding. That's why you see someone, they'll tell you, oh, I use like 6 parts a day, or some people will tell you I use like 3 parts in an hour. And then this bleeding doesn't just last for like 3 days, it goes on prolongs to like 7 days, from like I said, more than 7 days going to 2 weeks. It's just not normal. And if you start noticing any of this, if you have any of these symptoms that I mentioned now, please see a doctor to find out the cause, what the problem is. There could be tests that could be done, and scans, and then to just find out what's happening there instead of just leaving it to yourself and making the situation get worse. It's also important to know that what people struggle with when it comes to endometriosis is the difficulty getting pregnant, the infertility aspect of it. So these are the symptoms that people experience when they've got endometriosis. Like it's very difficult to diagnose endometriosis because sometimes the symptoms are similar to other symptoms. Like in medical term, it could be a differential diagnosis to something else. Yeah, but the most important thing is when you notice this, just speak to your doctor, and then you have tests and scans done to determine what the problem is. All right, so let me just talk about that aspect of difficulty getting pregnant. It is also worthy to note that it doesn't mean that if you've got endometriosis, that means you can never have a child. No, I think it depends on the stage. So that's why it's important that if you've got any of these symptoms, please speak to your doctor so that if there's something that can be done immediately, and I mean, if it's in your power, if it's in your control to do it, then you start doing it at the time. So I know it can cause fertility problems, because it may end up damaging the fallopian tubes or damaging the ovaries. That's the areas where those tissues, grow when you've got endometriosis. So, but it's also good to know that these days people do IVF. You can speak to your doctor, and after some tests and everything, they might recommend that you go for IVF if required or if needed. It's not like the hope is completely lost. Let's look at the treatment for this endometriosis. Right now, there's currently no treatment for endometriosis, but there are treatments. There are some things that could help you manage the symptoms. For instance, the pain that you're getting, they would prescribe some pain relief, some NSAIDs to help you manage the pain. Sometimes the doctor, depends on the age, the severity of the endometriosis, they can decide to advise you to go for surgery to remove those tissues and then improve your fertility and improve the pain as well, or the symptoms as well. And then, of course, the doctor would consider your age and your choice, because at the end of the day, everything is your choice. So, aside the painkillers that they give you, you can also be given some hormonal medication, some contraceptive patches, and like I said, the surgeries that would help cut away those patches of endometriosis tissue, right, causing all those concerns. And then the last one that people go for, but it depends on your age. Let's assume that you're not a woman of childbearing age, you're done with having children and everything. The doctor could advise that you go for hysterectomy. That's the removal of the womb or the uterus. Hysterectomy, that's what it's called. So before you undergo this procedure, the doctor would advise, you must have checked everything and must have given you like you make like an informed decision. You are informed about the advantages and disadvantages, and then you make your choice on if you want to go ahead with the hysterectomy or not. I've come to the end of this podcast, and like I always say, this podcast is just to bring to your notice some of these conditions, and then to tell you that there is still hope in some situations. And it's also to let our men know that no matter what your partner is going through, no matter what your wife is going through, just be there for them. This is the human body, and no one created themselves. You didn't create yourself by yourself. Sometimes there are things you cannot control. The ones you can control, like I always say, you have a way to control them. But the ones you cannot control, you just have to live with it. So please be there for the women in times of needs like this, in times of concerns or troubles like this, because it's not easy to go through this kind of situation alone. You can always do your research. And if you've got one or two of these symptoms, like I mentioned, just speak to your doctor who will diagnose and know if everything is okay. And if not, the management starts early. You start having some health education based on your diagnosis. So thank you very much for listening. And I hope you share with your loved ones. Speak to your doctor. If you have any questions, please ask your questions. My email address is zenithhealth@gmail.com, and I'm going to be doing some other podcasts and then some other topics, but for now, just like, share, please subscribe for more information. And if there's anything you want us to talk about, just send an email and leave a comment, and then we'll talk about it. Thank you very much, and I'll see you guys later. Bye for now.